breathe in for me. Good. Do the other side. Good. Now that I know the nostrils are patent, I'm going to check cranial nerve 1 by getting the patient to identify smells. So if you could, close your eyes for me. Occlude one nostril. What do you smell?
Cinnamon.
Good. Occlude the other side. What do you smell?
Coffee.
Good. All right. So once I do that, I'm going to move on to testing cranial nerve 2, which is optic. And I'm going to first start by assessing near visual acuity. So from 14 inches away, I'm going to get the patient to hold this up, occlude one eye for me, and read the low as long as you can.
683279.
Good. Do the other side.
683279.
And then we'll go fast.
683278.
Good. All right. And so once I've done that, I would assess the patient's distant visual acuity, and I would get them to read a Snellen eye chart from approximately 20 feet away, and do the same thing, cover one eye, read the lowest number, cover the other eye, read the lowest number, and then both eyes. So once I do that, I'm going to assess visual field by confrontation. And so I'm going to get you to do this for me, and whenever you see my fingers come into your line of vision, just point up. Good? Good? Good. All right, so once I've done that, I'm going to assess cranial nerve 2 and 3, which I'm going to do direct and consensual pupillary reaction. Good. Good. Now I was assessing 2 and 3, 3 being oculomotor. Next, I'm going to assess cranial nerves 2 and 3 once again using or by accommodation. Get the patient to stare off in the distance at a far object, and then come look at my pen for me. Good. And next, I'm going to assess cranial nerves 3 and 4, 4 being trochlear. And so I'm going to test this with convergence. I'm just going to get you to follow my pen in. Good. Next, I'm going to assess cranial nerves 3, 4, and 6, 6 being abducens nerve, with the 6 cardinal signs of gaze, stopping at all the extremes, checking for nystagmus. So I'm going to get you to just follow my pen. Good. So once I've done that, I'm going to move on to the fundoscopic exam. And for the purposes of this exam, I would dim the lights, but it's kind of difficult to do right now. But once I've done that, I'm going to check my diopter and my fundoscope, and I'm going to make sure that everything is clear, it's adjusted correctly. All right, and so I'm going to stand 4 to 6 feet away, and I'm going to assess corneal light reflex. And then once I've done that, I'm going to move in approximately 15 inches from the patient, 15 degrees lateral to the patient's midline. And I'm once again going to find the red eye reflex. And I'm going to keep my finger on the diopter at all times. And then I'm going to let that guide myself in. When I'm looking at the eye, I'm assessing for the optic nerve and its margins, the cup to disc ratio, which should be 2 to 1, the retinal vessels, and the condition of the retina. And so I'm going to get you to look straight into the eye for me. Light for me, sorry. I'm assessing the fovea and macula. Good. I'll do the same thing on the other side. Alright. Good. Look in the light for me. Good. Alright. So once I've done that, I was assessing the optic disc and its margins, cup to disc ratio, retinal vessels, and condition of the retina, as well as the fovea and macula. So once I've done that, I'm going to move on assessing cranial nerves 5 and 7, which is trigeminal and facial nerve. And I'm going to do this by doing a corneal brink reflex, but I'm just going to verbalize it for purposes of this exam. And so I get the patient to turn to their left. Now just brush up against the anterior portion of their cornea. Same thing on the other side. Okay. Now, once I've done that, I'm going to continue testing the motor and sensory function of the trigeminal nerve. So I'm going to get the patient to clench their teeth for me, clench their jaw, palpate their temporalis muscle, as well as the masseter muscle. And then I'm also going to assess the sensory function of all three branches of the trigeminal nerve. Right. So this feel like this.
Mm-hmm.
Right. So this feel like this.
Mm-hmm.
This feel like this.
Mm-hmm.
Good. So once I've done that, I'm going to test the facial nerve, which is cranial nerve 7. So I'm going to get you to close your eyelids for me, and I'm going to try to open them. All right, so just keep them closed. Good. All right, next I'm going to assess facial movements to test the facial nerve as well. So I'm going to get you to raise your eyebrows for me. Good. Frown. Show me your teeth. Smile. And puff out your cheeks. And then puff your lips and try to whistle for me. Okay, good enough. All right, and so next I'm going to assess cranial nerve 8, which is vestibulocochlear. And so I'm going to stand 1 to 2 feet away, occlude the patient's ear, whisper a 2-syllable word, get them to repeat it back to me.
Baseball.
Good. Muscles.
Football.
So you show your shoulder. Good. Now once I've done that, turn to your left. Good. Turn to your right. Good. All right, next I'm going to assess cranial nerve 12, which is hypoglossal nerve. So I'm going to get you to stick out your tongue for me. Good. Checking for the symmetry, size, and color of the tongue. Get you to move it left or right. Good. And then I'm going to assess strength. I'm going to get the patient to push against their cheeks. Good. Other side. Good. Next, I'm going to test the patient's lingual speech, and I'm going to get them to repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Good. And that's assessing cranial nerve 12 hypoglossal as well. Next, I'm going to move on to the motor exam. I'm going to start off by inspecting for muscle bulk and atrophy and tone in the upper and lower extremities. And I'm going to palpate. Sorry, my hands are cold. All right. I'm going to assess for tone as well. Good. 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 Next, I'm going to move on and test muscle strength. So we're going to start with shoulder abduction. Good, and that's C5 and C6, and shoulder adduction, good. And then elbow flexion, which is C5, C6, good. And then elbow extension, which is C6, 7, 8, good. Wrist extension, C7, 8, good. Wrist flexion, C6, 7. And then I'm going to do hand grip, which is testing C7, 8, T1, good. And then get you to spread your fingers out for me for finger abduction, assessing C8, T1, and ulnar nerve. Good. Good. And then I'm going to assess opposition. Good. Good. That's assessing C8, T1 as well as the median nerve. Next, I'm going to move on to the lower extremities. I'm going to assess hip flexion, which is L2, L3, L4. Just go ahead and put it over. Good. This side. Good. All right. I'm going to do hip adduction, which is L2, L3, L4. Good. Hip abduction, abduction, which is L4, L5, S1. Good. Good. And then hip extension, which is L5, S1. Good. All right, and I'm going to assess knee extension, which is L2, L3, L4. Good. Good. Knee flexion, which is L4, L5, S1, S2. Good. All right, I'm going to assess dorsiflexion. I'm going to get you to do this for me, and I'm assessing for L4, L5. Good. Good. I'm going to do the opposite. I'm going to get you to push down for me. Assessing plantar flexion, which is S1. Good. Good. Let me get you, bring your big toes up for me. Good, good. Extension of the great toe, which is L5. Next, I'm going to move on to the sensory exam. And so I'm going to start off with C5. Does this feel like this? Mm-hmm. Make sure you keep your eyes closed for me. All right. C6. Does this feel like this? Mm-hmm. All right. C7, middle finger. Does this feel like this? Mm-hmm. C8, ring finger index or pinky. Does this feel like this? Mm-hmm. Okay, good. So once I've done that, this like this, T1. All right, put your hands to the side for me. And I would just verbalize, I would do T4, which is the nipple line. T10 is umbilicus. L2 is inguinal. And then I'm going to move on to L3. Is this, like this. Yep. L4 is this. Sorry. L4 is this. Be like this.
Yes.
Okay. L5 is this. Be like this. Okay. S1 lateral foot is this. Be like this. Good. All right. And so once I've done that, I'm going to assess positional sense. The patient to close their eyes. I'm going to stabilize their middle or their index finger. I'm going to move their distal phalange. And I'm going to ask them what position the finger's in. Up.
Down.
Good.
Down. Up.
Good. And do the same thing with the big toes, great toes.
Down. Up.
Good.
Down.
Place a familiar object in their hand and get them to identify it.
Battery.
Yes. All right. How about this one?
A cotton ball.
Good. Once I've done that, I'm going to assess graphesthesia, and I'm going to write a familiar letter or number on the patient's hand, orienting to them, and get them to tell me what it is.
3.
Yes.
7.
Yes. All right. So once I've done that, I'm going to move on to testing the reflexes. And so I'm going to start with the biceps reflex. Can you get you to flex for me? Good. This is assessing C5, C6. Good. Next I'm going to do brachioradialis, which is C5, C6 as well. All right. And I'm going to do the triceps tendon, just relax for me, which is C6, C7. Good. Move on to the other side. Flex for me. Good. Relax. C5, C6, biceps. All right. And then brachioradialis, C5, C6. And then relax for me. Triceps, C6, C7. Good. Let me get you to lay supine for me. And I'm going to assess the upper abdomen, which is T8, T9, T10. Good. And then the lower is T10, 11, 12. Good. All right, I'm going to move on to the patellar tendon reflex, which is L2, L3, L4. Good. Good. Next, I'm going to move on to the Achilles tendon, which is S1 with the foot slightly dorsiflexed. Good. Good. Next, I'm going to do a plantar reflex, which is L5, S1. Good. Good. Now once I've done that, I'm going to check for ankle clonus. Good. Good. All right, once I'm done with that, I'm going to assess coordination. And so I'm going to start off with the patient with their eyes open. I'm just going to get them to put their finger on their nose, touch my finger. Good. Moving around. Good. Back to the middle. All right, now go ahead and close your eyes and touch your finger. Good. Good job. All right, let's do the other hand. All right, close your eyes for me. Good job. All right, so next, I'm going to do a rapid movement. And so I'm going to get you to just kind of shake your hands like this, and then do this. One more time. Shake your hands like this, and then do this. Good. Next, I'm going to get you to tap my hands really fast.
Hi, my name's Adrian. I'm an EMT. What seems to be the problem today? I fell and my arm hurts.
Okay, go ahead and stabilize your arm. I'm gonna feel your pulse. All right, and what finger am I touching?
My pointer.
All right, and can you wave your fingers for me? All right, so I'm gonna go ahead and put a SAM splint on you. I'm going to measure your uninjured arm, and I have my partner manually stabilize your injured arm. Right, go ahead and hold on to that. All right, and I'm gonna make sure it extends across the halfway across the proximal joint. Okay. All right, now I'm gonna go ahead and put it on your injured arm. Go ahead and grab onto it, and you can use your hand to stabilize it. All right, and now I'm gonna go ahead and wrap it. I'm gonna make sure not to wrap the injured section. Okay, now I'm gonna go ahead and put on the sling. Under here. And I'm gonna go ahead and tie it around her neck. And now I'm gonna go ahead and apply the swath. I'm gonna go around here. And I'm gonna reassess pulse. What finger am I touching?
Pinky.
And can you move your fingers? Awesome. And that'll be it.
Like confrontation. So I'm going to have you put your hands in a fist. I'm going to wave my hands around. I want you to point up when you see them come in your vision. Okay, I'm going to test cranial nerves 2 and also cranial nerve 3. So I'm going to get my pen light to test direct and consensual pupillary light reaction. So I'm going to shine it, direct, consensual, and then switch sides, direct, consensual. In addition, I'm going to test for accommodation, and that test goes with cranial nerves 2 and 3. So I'm going to have you look at the window, and then now I want you to focus on my pen light. Okay, I'm going to move on and test cranial nerve 3 and also cranial nerve 4, which is the trochlear nerve for convergence. So I want you just to look at my pen light as I move it towards you. Okay, moving on, I'm going to test cranial nerves 3, 4, and also cranial nerve 6. I'm going to do the extraocular muscle movement. So I'm going to have you be 1 arm's distance away. Perfect. I want you just to look at my pen light as I move it. I don't want you to move your neck, okay? So just your eyes. And when I'm doing this, I am inspecting for any nystagmus. I forgot to mention earlier when I was testing for visual acuity that I would do the distant visual acuity with the wall mountain Snellen chart from 20 feet away, but we don't have that in this room right now. I'm going to dim the lights now for the ophthalmoscope exam. I'm going to turn on the light and make sure the diopter works. I'm going to stand 4 to 6 feet away to check the corneal light reflex for symmetry. Okay. Going to move closer, 15 inches. I'm going to get check for the red light reflex. And then I'm going to inspect for the optic disc margins, the cup to disc ratio, the retinal arteries and veins, and the condition of the retina. So just keep looking over there. And now I want you to look into the light. I'm going to inspect the macula and the fovea. And then I'm going to repeat it on the other side. So, 2, and then now look into the light. Okay. I'm going to turn this off now. We can turn on the lights, please. Thank you. I'm going to move on and test cranial nerve 5 and 7, which are the trigeminal and the facial nerves. I'm going to test the corneal blink reflex. So I want you to keep your eye on my finger. I'm just going to, okay, and now look on this side. Okay, I'm going to now test cranial nerve 5, which is the trigeminal nerve. So I'm going to have you clench your teeth. I'm just going to palpate the temporalis and the masseter muscles. In addition, I'm going to get my cotton ball back. I'm going to test for light touch sensation, which tests for cranial nerve 5, the trigeminal. There's 3 branches, so I'm going to have you close your eyes for me. Does this feel the same as this? Yes. Okay. Does this feel the same as this? Yes. Okay. Does this feel the same as this? Yes. Okay. Moving on, I am going to now test cranial nerve 7, the facial nerve. So I'm going to have you raise your eyebrows for me. Okay, I want you to frown. I want you to show me your teeth. I want you to smile. Puff out your cheeks. I want you to pucker your lips. And then whistle if you can. Okay, moving on, I am going to test cranial nerve 8, which is the vestibulocochlear nerve. So I'm going to cover one ear and whisper a word. I want you to repeat it back to me. Football. Okay. Cupcake. Okay. I'm going to move on with the exam and test for the gag reflex, which tests for cranial nerve 9, which is the glossopharyngeal, and then cranial nerve 10, which is the vagus. I'm just going to mimic it, so I would just open up and just touch it in the posterior pharynx, but I'm not going to do that bilaterally. I'm going to now test cranial nerves 9, 10, and 12, which are 12 is the hypoglossal nerve, so I'm going to have you say ah. Okay, in doing so, I am just inspecting the soft palate and the quality of the patient's voice and speech. I'm going to put this down. Moving on, I'm going to test cranial nerve 11, which is the spinal accessory nerve. So I'm going to put my hands, I just want you to resist. So try to raise your shoulders, okay? That was the sternocleidomastoid. I'm going to put my hand here, turn your left, okay? That's the trapezius. Okay, moving on, I'm going to test cranial nerve 12, which is the hypoglossal nerve. So I'm going to inspect, I guess, make sure that her tongue comes out, and is it symmetrical, not like in the midline. Gonna make sure I can move left and right, and then, okay, just open, move it left and right. Want you to press your tongue on the inside of your cheek, which is, there we go, and then the other side. Okay, and lastly, I'm going to test for lingual speech, so I want you to repeat the phrase, no ifs, ands, or buts.
No ifs, ands, or buts.
Okay, and that was the end of the cranial nerve exam. I'm going to move on to the motor part of the exam. So I'm first going to inspect the upper and lower extremities for muscle bulk and atrophy, and then followed by muscle tone. So first the inspection, then muscle tone. Similar to what I did before, I'm going to put my hands on. I just want you to resist my movements. Okay, so for shoulder abduction, T5, C6. Shoulder adduction, T6. Okay, I want you to put your arms out like this. Try to bring them towards you for elbow flexion, which is C6, C7, and then elbow extension, C6, 7, and 8. I want you to put your hands out for me. Wrist flexion, so C6, C7, and then wrist extension, C6, 7, 8. I want you to grab onto my fingers for hand grip. Okay, so that is testing for C7, C8, T1. I want you to I'm gonna try to resist. This is testing the ulnar nerve, C8T1, and then thumb opposition. I'm gonna try to break them open. That's also C8 and T1, but the median nerve. Okay, moving on, I'm going to now do the lower extremities. So I'm gonna try to have you, I'm gonna do the same thing. Put my hands on, I want you to try to resist. Hip flexion, L2, L3, L4, and then hip extension, L5, S1. Bring them outwards, L4, L5, S1, and then inside. So that's hip abduction, sorry. And then inward is hip adduction, so L2, L3, L4, perfect. Moving down, I want you to try to bring your legs out. So that is L2, L3, L4, that's knee extension, and then bring them back. So this is knee flexion, L4, L5, S1, S2. Okay, now I'm going to try to bring your toes up. So this is ankle dorsiflexion, this is L4, L5, and then plantar flexion, and that's S1. And then I'm going to do the great toes on each side, extension. Bring them up. That's L5. Okay, moving on, I'm going to test for light sensation. So I'm going to grab a cotton ball. I want you to close your eyes for me, and then I'm just going to wave it around. So I'm going to do C5. Does this feel the same as this? Yes. Okay. Can I have you actually have your arms out a little more? Perfect. Thank you. You can close your eyes again. Does this feel the same as this? Yes. Let me just repeat that. It should be all the way to the thumb. That's C6. C7, does this feel the same as this? Yes. Okay. And then C8, does this feel the same as this? Yes. Okay. T1, does this feel the same as this? Yes. Okay. And then T4, does this feel the same as this? Yes. Okay. T10, does this feel the same as this? Yes. Okay. And, so this is L2 now. Does this feel the same as this? I would do it under closing.
Yes.
Okay, perfect. Now L3, does this feel the same as this? Yes. Okay. L4, does this feel the same as this? Yes. Okay. L5, does this feel the same as this? Yes. Okay. And then S1, does this feel the same as this? Yes. Okay. I want you to keep your eyes closed. I'm going to grab one of your hands. I'm going to test for position sense. So I'm just going to wiggle your finger. I just want you to stay relaxed. At the DIP joint, is your finger pointing up or down?
Up.
Okay. I'm going to do it on this side. Wiggle, wiggle, wiggle.
Down. Up.
Okay. I'm going to move down here to your toes. Sorry if you're ticklish.
Up.
Okay.
Down.
Okay. With your eyes closed still, I'm going to put something on your thumbnails and your toenails. I want you to tell me if you feel vibration or pressure. Just testing for vibration sense. Ready? Vibration. Okay. Ready. Vibration. Okay. Vibration. Okay. Vibration. Okay. Moving on to the well, now I'm going to test. So I'm going to test for stereognosis and graphesthesia. So I'm going to have you keep your eyes closed. So I'm going to put an object into your right hand. I want you to tell me what it is.
Paperclip.
Yep. And then now in your left hand, what?
Cotton ball.
Okay. With your eyes closed still, I'm going to draw a number on your hand. I want you to tell me what it is.
2.
Yep.
3.
Okay. Moving on now, I'm going to start the reflex test. So I'm going to put here the biceps, which is C5, C6. Find it right there. You can just relax a little bit. Okay. Now on this side, relax. Okay. I'm going to move on to the brachioradialis, so I'm going to put her hand there. Okay. And then now this side. That was C5, C6 if I didn't say that. I'm going to move on to the triceps, which is C6, C7. So I'm just gonna position your arm. I want you to relax for me. Ready? Okay. And on this side, I'm gonna have you relax for me. Go. Okay. I'm actually gonna have you now lay down for me. I'm going to test the abdominal reflex. Thank you. You're welcome. So we're gonna do T8, T9, T10. I would do this under clothing, but T11, which is under the umbilicus, and T12. Okay, perfect. I'm gonna now have you sit back up for me. I'm gonna move on and test the patellar reflex, which tests L2, L3, L4. So I want you to look the other way for me. Okay, this side. Okay, perfect. I'm going to now move to the Achilles tendon, which is testing S1. So I'm gonna slightly dorsiflex the foot right there. Okay. And this side, and switch hands, so dorsiflex. Okay. I'm also going to move down and test the plantar reflex. That's testing L5, S1. So I'm going to just go, sorry, I'm gonna just raise it up a little bit. Okay. I didn't say, but you just go basically outer to inner. And while I'm down here, I'm going to test for ankle clonus. So I'm just gonna wiggle and tap, wiggle and okay. Moving on, we're gonna test the cerebellar function. So I'm gonna have you, it's called the finger to nose test first. So I'm gonna have you use your index finger and use it to touch my finger and then back to your nose. Perfect, keep going. And then I'm just gonna move my finger. I want you to keep doing that. Should be going up. Here we go. And now with your eyes closed, I want you to try to touch my finger, okay? And now on the other side, you do the same thing, perfect. And then here we go. And now with your eyes closed, it's okay.